Okay, so welcome to our introduction to GP Connect. My name's Josh. I'm the managing director of CareLineLive, and we've got on the call with me is my marketing manager Marie Page, and also my director of operations Nick as well. Just while some other people join, I know some of you are customers, some of you are not customers, so just a bit of a brief overview on who we are. So we are a care management system operating in the home care space across a very different array of customers, from small to medium-sized businesses right up to we have some NHS clients using us and some of the largest care agencies in the UK as well. We have over 650 customers with more than 20,000 people using CareLineLive every single day. With me on the call, we've also got one of our customers, Alice Allen, who's Deputy Manager of North Shropshire Homecare, and I'll introduce her as we move through this presentation, as she's got some valuable insights that I think you'd all like to hear. So I hope that you're all aware of what GP Connect is, and that's the reason why you've all joined this webinar. But just in case you don't, what it is a system that shares patient information with appropriate staff so it can help you deliver better care. And the information that's shared comes from the GP practices. So a CQC registered care provider can use the GP Connect to access the restricted view of a person's GP record. There are some requirements of what you as a business need in order to be able to do this, and our team can help you, guide you in the direction of what it is that you need to be able to do or need to be able to evidence in order to activate GP Connect. But basically, you have to have a digital social care record assured supplier in place. So your care must be managed through a platform such as CareLineLive, and that must match the assured solutions list, which we do, and that's why we can integrate with GP Connect. It is worth noting you can go on the DSCR website and you can see assured suppliers, but it's worth double checking on the capabilities section, I believe it is on the website, which allows you to see actually who does and doesn't have the various features. There are some listed on there that currently do not have GP Connect. You must have reached the standards met on the Data Security and Protection Toolkit, or NHS DSP Toolkit. It's a fairly straightforward process. It just talks about information security and making sure that actually you are looking after the information that's stored in your business. You have policies in place for things like cyber security and things like data loss prevention and stuff like that. There's a couple of different ways of GP Connect working, but predominantly the process is that a care professional would look at a platform like CareLineLive. It would be authenticated via a client ID or the NHS number and the date of birth, and then that would display on the screen. What we then do is we request that data from the GP Connect server, and then we can see the GP record, which is viewed on CareLineLive but never stored in CareLineLive. And that's one of the key things to remember here, is that we don't store this data. Every time you go and look at a GP Connect record, it is feeding that information live back from the NHS spine, which is what integrates with the platforms that GP uses. After the webinar, you can go and have a look at this information sheet, and there's some guides on here. So there's 2 links that you might want to go and have a look at that give you a bit more of an overview of what the GP Connect process is. We've now got a number of customers using GP Connect, and the feedback from it's been really, really positive. This one from Elizabeth Gilbert, who's the registered manager at S-Care, has said, the GP Connect is a great tool for me, especially if the client just does not know if they're allergic to anything or doesn't really know which tablets they're having. It saves a lot of time, especially with dementia patients, where I would be phoning the GP practice to verify medication just to be told to send an email and waiting for a call back. Also, with the summary, it's giving a wider insight to the health problems that the client may be suffering from or conditions that they have had in the past. All this knowledge really assists with the client's personal care plan, as well as, and where required, gives the carer a better insight on how to assist the client. So that's just one customer that's come back with some really great feedback. But the NHS have produced this really, really helpful, complicated diagram that they believe shows the benefits to both the system, the staff, the people and carer experience, and then the people outcomes. And while you have a look at this, and I'll leave this screen on for a little while, I'd like to introduce you to Alice, who's hiding somewhere in the background, just so we can run through a couple of questions with Alice and talk about how GP Connect has worked for her at North Shropshire Homecare. Alice, are you there?
I am here, yeah. Hi.
Perfect. Okay, so how have you found GP Connect?
It's really made a difference for us. I think so. We're quite a small company. We've only got 3 members of staff in our office. So for us, time's quite valuable. And we would have some members of staff, especially our care coordinator, would spend a good, I want to say, 3 to 4 hours a day on the phone chasing things like this. So we'd get, changes every day for people's needs. And a lot of the queries that we've had now just instantly get answered with GP Connect. So we don't find that we're waiting for callbacks or just on hold or things like that. So we have found it very, very useful, most for time management, really.
So, what benefits do you think GP Connect has given your staff then? Aside from the time management, is there sort of key standout features that you think have really been beneficial?
Yeah, definitely. We've had, issues where a carer's gone to a client's house, and because they have dementia, they will say someone's been in my house, but I'm not quite sure what was said or what I have to do now. Normally we would then have to try and figure out who's been, whereas now, because we're on the restricted access, we can see the last 3 encounters, we can see who's been, what's been said, and what action is taken. So we can then say to the client, this is how we need to go ahead with things, or we can let family know this has been done. So it just kind of gives reassurance to the carers family and the client themselves without having to try and chase up or figure things out, really. Other benefits that we've had as well is ones that we haven't expected, or we weren't even aware that that was something that GP Connect would do. So we had one lady who came from a care home. We normally take people straight from hospital, but she came from a care home. And she was registered to a different GP, and that hadn't been registered back to her original GP for where she lived. And it was actually GP Connect that flagged this when we put in the details for her GP, and it wasn't matching. The system said, actually, we've got something different. So there's been a few things that we weren't expecting as benefits that actually are benefits.
So, aside from kind of you having better information and better access to that service users' records, what would you say would be the standout things that have actually given or really delivered a benefit to your service users?
I'd say identifying sort of things that might not be, right now, but they might be in the future. So I think it was mentioned on that previous slide about allergies and things like that. We'll go to people and they'll say, oh, I've got nothing wrong with me, they're on 10 different tablets, but they don't know what it's for, and things like that. And when you've got the allergies, you might have someone who's not prescribed that medication right there and then, but maybe 4 or 5 months down the line they are, and it somehow slipped through the cracks, and we can sort of identify that and put a stop to it before that client has been put in harm's way. Essentially, it could end up with something much more serious, but because we've got that information from the get-go, it just helps us in the future with anything that might arise with a change in needs.
Okay. And in your business then, what changes are you now seeing after having GP Connect?
For us, mostly it's just better communication, I would say. We've got a better idea of what we're dealing with people. We've got better communication with families, we've got better communication with the clients themselves. And that means that we can just provide that more person-centered care, and it's more effective, which everyone wants to be hitting those sort of CQC points of effective caring, well led. We've had so many things that could have been mistakes not been mistakes because of GP Connect and what it offers.
Brilliant. So finally, I think we, talking at the beginning about the things that customers need in order to be able to get GP Connect, such as being assured on the DSP toolkit, etc. What would you say the process was like for you? Was it difficult? Was it straightforward? Are there things that you were glad that you had in place, or any learnings that you might have had from that kind of that initial process of becoming a DSP toolkit certified business and then taking on GP Connect?
Yeah, for us, we were already DSPT certified, so that wasn't an issue. We just had to sign the I can never remember the name of it, NSDA disclosure. We had to do that, which took me probably 5 minutes, if that, and then sent an email through to the support team to say, look, we've done all this, we feel like we're ready now. We then had a demo with the dev team, I believe it was, just to say this is how you set up, this is how you will add someone on. I think the probably the most not difficult, but the biggest thing that you will find is actually speaking to the clients and getting them to sign on, because it's really important that you stress what GP Connect is and what we can access compared to what an actual GP could access to. So for us, because we're on the restricted one, we only see a limited amount and we only see what's relevant for the care now. I think we did have a few people that are a bit nervous and thinking you can see things that happened 10, 20 years ago to me that I don't want people to know. And we say, no, unless it's relevant now, then we won't know about it. And that's the key thing that I think was the sort of the only issue that we found was just, reassuring people and making them understand that it's not full access to records. It is just what we need to be able to deliver the best care. And then we just made the consent forms. On the consent forms we made, we said, this is what we will be using your information for. This is what we can see. This is what we can't see. And once they had that all laid out and explained to them, a lot of them, majority of them, were very happy to sign on.
Thank you. I think that's really useful, and I think that hopefully gives people some confidence that it might appear like a daunting process at the beginning, but actually the benefits that you get from following that process are phenomenal.
Yeah.
So obviously we've heard about you were talking about restricted access and things. There are different levels of GP Connect, and it depends on who you are within a business as to what bits of data that you can access. But the following roles in CQC registered providers have access via the role-based permissions, which is the CQC registered manager, deputy manager, pharmacists and technicians, nurses, and social workers. They're all of the people that will currently see it, and they'll see, as you said, Alice, the last 3 encounters from the GP practice, the active problems and immunisations, medications, and allergies. So what I'd like to do now is actually move forward and give you a demonstration of what CareLineLive, of what GP Connect looks like within CareLineLive. So I'm just going to change my screen sharing. So for those of you who aren't CareLineLive customers, welcome to the CareLineLive management portal. This is where we're just looking today, and I'm not going to go into any other sections on it other than the GP Connect section or bits that are relevant to it. This is where you'll see the client profile. So you start with an overview, etc. And this is where you'll have to do things like putting in the NHS number, which is something you'd have to do anyway. Moving forward then, in order to get access to GP Connect, you have to complete the choices section. The choices section is where you will list whether or not they've given you permission to access GP Connect, and you'll put some bits of data into here as well. If you haven't done that, then GP Connect won't load for that patient. Then down finally on the left hand side, we have the GP Connect section. Now it's worth noting that what I'm about to show you links to the NHS test server. It also links to an NHS test user as well. Even though we are a software provider that work with GP Connect, we're not allowed to even look at our own GP records on here. So this can sometimes be a little bit flaky on the test server, but here we are, it's working for us straight away. So basically this version that we're looking at here has the full access. So it's pulling out our company name. It's also pulling out our DSP reference code. So it's just saying we are the person that's going to go and look at that record. So we'll continue to GP Connect. And this is what we've got. So as I said, this is live data, or not necessarily live, but this is the most accurate data and up-to-date data that's being fed into the NHS spine that the GP's produced. So you have the summary, you have the last 3 encounters here. You have whether there's any active problems and issues, whether there's major inactive problems and issues, and any allergies and medication that's been prescribed to that particular client. Under encounters, we can go and look and we can filter by the date. We have the full access on here, so we have a little bit more information than some other people may have, but we're able to see all of the records within here. We can go and look at the clinical items, which is giving us things like any documents, any consultation letters. We can't view them, but we see that they're there. We have the problems and issues. So what the active problems are and the inactive problems, and whether there's any other relevant inactive ones. We've got the allergies and adverse reactions as well. This can obviously be really useful, particularly if there's things like medication allergies, and you need to be aware of those. We've got the medications that are prescribed within here as well, both repeat prescriptions as well as discontinued ones, and any other ad hoc medication that they may or may not be prescribed. We're able to see a list of referrals as well, so we can see that actually this person was referred to an allergy clinic. We're able to look at any observations, so that may be, for example, a urine test, it may be home health attending or a district nurse. That's things that have been recorded within the GP Connect platform, not through us. As I said earlier, for those who missed it, this is a read-only interface. You can't push any data back into this system. You can only see what data has been put there by somebody else. And that's the same with any platform that offers you a GP Connect integration. So even if you went with a different assured supplier to us, the view would be the same. You then have a record of immunizations and any administrative items within here as well. So that's the GP Connect platform within CareLineLive. And if I just swap back to my presentation, I also then have some FAQs, which I'll run through with you as well. So who can access it? As I said, there's two different levels. The level that Alice, for example, has access to is the restricted view. The view that I just showed you now is the clinician's view. However, there's not a huge amount of details that differ. In principle, it's the same. It's just the quantity of data that you're able to go and see. If you're based outside of England, you can't use GP Connect. It is only available for England. And it is included in your subscription with CareLineLive. There's no additional charge for it. So if you want to activate it, as long as you've been through the processes that you need to go through, which again, my team can help you with. We can't help you with the process, but we can tell you which bits you need to do. Then please get in touch and we can help you with that. The benefits, as we said, are that you can use and view the records instantly. It's up to you to get the client's permission, and it's very important, as Alice said, that she's got her own form that she's built that the client approves to say, or other relevant person, be it power of attorney, for example. Anybody else who approves access to it, you must have that recorded, and that's absolutely your responsibility to go and make sure that's been recorded and stored. But once you've got that, you can access that record instantly, and therefore that's obviously saving you time. The patient records that you can access, they must only be those who are in receipt of direct care from you. So just like I said earlier, although we are assured, although we have ticked all the boxes, we're not allowed to go and look at our own GP records through our connection. And that's really important that you make sure that you do that and listen to those guidelines. And finally, are we part of the DSC assured supplier list, which is the digital social care record? Yes, as part of that, that's why we have access to and why we can give you access to GP Connect. So thank you very much for attending our webinar on GP Connect. Just staying within topic, are there any questions that anyone may have? Please just put them in the chat window now and I can just answer them. I see there's one from Rebecca. We can't review so Rebecca's question, for anyone who can't see the questions, is can you view the test results? No, within GP Connect, you can't view the test results, to my knowledge anyway.
Josh, there was one other point that Nick made during the talk where Alice talked about how they had a meeting with the dev team as part of the setup process. It's worth noting that Alice was North Shropshire, one of the very early organisations that came onto this. We've streamlined that process now, so it happens very, very quickly. You don't have to have meetings to be able to set it up. Yeah,
that's good point, Marie. There is another question here as well from John at In Friendship, and I just want to read that out and answer that so that people can hear that. John said, are all NHS organisations available and connected with GP Connect? Theoretically, the answer to that is yes. Nick's right. We've had one instance where one surgery wasn't reporting data back, but in principle, everything will be connected. There's another question. Can you see previous and current medical history? Yes. Depending on the view that you have access to, you're able to view the inactive problems and the active problems, as well as inactive repeat prescriptions and active repeat prescriptions. So, Karen, hopefully that answers your question about, does it show current medications? Yes, it does. And then there's another question about, do all GPs agree for GP Connect? Yes, that's part of their platforms. You'll find that all platforms should now report through the GP Connect interface. As we said earlier, we've had one instance where one hasn't been, but that's as a result of them, not us. Tony, you've raised your hand. Do you want to? You can either put your question in the chat box or you can unmute and ask it. Actually, I'm not sure you can unmute. Actually, let me see if I can. Allow mic. There you go. You can unmute yourself now.
Much. I apologize. My camera doesn't seem to be working either, and the chat function is not working. My question was when you mentioned about the process and the clients having to sign on. What's the legal requirement from the care provider, a registered care provider, if the clients have got severe learning disability and lack capacity to be able to make that decision or to sign on?
Okay, Tony, that's a really interesting question. I'm just going to put your mic back on mute now. You can unmute it later just in case any noise happens or anything. Look, from our perspective, we're giving you the tools to go and use GP Connect. It's as I said, it's your responsibility to ensure that you follow the correct processes when you onboard clients and when you give access to or set up the access to a client's GP record. That's not our responsibility to ensure that you're doing that correctly. There are processes in place, and I believe there's guidance on. And in fact, Alice, you may be able to answer some of this potentially, just for Tony, about what processes you have in place maybe for somebody that is they lack enough capacity to be able to agree to it themselves.
Yeah, if they lack capacity, you'd hope that they would have a power of attorney, and you can also sign. You can get a power of attorney to sign the consent form, and when you're logging that consent form onto GP Connect or on CareLineLive, it will ask who has approved this, and they will ask for the name, and it's got to be someone who's listed on that client's people section of CareLineLive. So it all kind of connects. So people lacking capacity can still go onto this if the power of attorney allows for it. If they don't have a power of attorney, I would probably be looking at sort of a social worker to get that something in place, because obviously if they don't have capacity, you're looking at best interest and things like that. So yeah, it does allow for people with and without capacity. It's just who's the decision maker. It has to be them that signs and makes the decision.
Thanks, Alice. That's really useful. There's a couple of other questions that we've got in here as well. One of them, just to kind of reiterate a point that we made earlier, Sid has asked, can we book appointments using the GP Connect? No, just to be absolutely clear, GP Connect is a read-only system. We cannot request anything. We can't control it at all. And that's the same with any of the other platforms that offer a GP Connect interface. You are only reading that record. You're not able to instruct a task or anything like that through it. So if you need to book an appointment, you'll need to call the GP or another way of doing that. There's then Lynette's asked a support question. Nick, thank you very much for answering that. There's two questions then about the consent form. Lizzie's asked Alice if you could share one. That's up to you, Alice, if you feel that that's something that you want to do. If you reach out afterwards, we can maybe put you in touch. Karen's also asked whether or not you need a specific consent form or your own. You should be able to use your own form, because it's all about how you ask the question. So just as Alice said, it was about how she was looking at power of attorney or relevant other stakeholder who had the authority to say that. So you may have terms and conditions that you might want to put in there, etc. So you would use your own that would follow the guidance that you've been given by NHS of who needs to ask that. Rebecca, we don't have any sample information on the benefits that could be given to a client. That's something that you should or possibly can get from the NHS website. Otherwise, building your own sort of building your own document based on this presentation, you might be able to do something with that information as well.
We will send this presentation out, and that slightly complicated slide that had the benefits for service users and providers, etc., has a list of them there, so you could lift it from there if you wanted. That was from the NHS.
Okay, thanks, Marie, for clearing that up. Any other questions that you have? I think we've got a couple of minutes left on the webinar, so if there's anything that anybody would like to ask, then please feel free, again, in the chat box.
I wondered whether, while we're waiting, whether Alice had anything else, final words she wanted to share.
No, not really. Just happy to answer any other questions. And I mean, I feel like a lot of people are kind of worried, or not worried, but have the concerns about the consent form. If you guys would like, I could send you what we've got, and then if you want to give that to your customers and say, look, this is what one of our, providers or one of our customers uses their template. If they want to use that as well, I'm happy to do that, because I think it was a bit worrying when we were making the consent form. We were like, we need to make sure that we've definitely got everything written down of what it is and what it isn't, so that the person is definitely informed and they are signing to make sure that this is just what they're allowing. So I'm happy to do that if that helps you guys out as well.
That would be, I think that could be really useful. Thank you.
Yeah, if you mail that over to me, Alice, I'll send it over with the slide deck and with the recording in the next day or two.
Okay,
yeah, that's fine.
So Lynette just asked another question. How do we link to the NHS organisation? It's really important that you go through the NHS DSP toolkit, which again is listed in this presentation earlier on. So once we've recorded this and finished it and published it, if you want to go back and have a look at that, Nick's actually very helpfully just put the help guide for using us, or if you use CareLineLive, for how you link up with GP Connect here as well.
Can I ask Josh, maybe Alice could help us with this? There's one question which may be helpful to everyone, which is what the difference is between the restricted view and the full view. And I believe in the restricted view, Alice, please help me with this. I think you get the basic summary record, you get the last 3 encounters, you get medication, allergies, and something else. And
yeah, it's so it's your sort of overview, your active current medical conditions, or inactive if it affects you now. So say, for example, leg amputation, obviously that happened however many years ago, but it still affects the person now. So you get that, you get medications, allergies, and immunizations is the other one. So your COVID and influenza jabs mostly is what we see on there.
Brilliant. Well, I'd like to say thank you, Alice, for joining. It's been really useful, and hopefully the people on the presentation and the webinar have found that really useful as well. And from my perspective, thank you for everybody that's joined. I hope you found it interesting. If you're not a customer of CareLineLive and you're interested in finding out more about GP Connect and the other features of the platform, then please reach out. You can either email my sales team, sales@carelinelive.com. You can fill in a demo request online, or you can call us on the number that's listed on the website as well, which is carelinelive.com. Otherwise, if you are an existing customer and you think you're ready to go, or you'd like to start looking into GP Connect, then please reach out to the support team or follow the links that are listed in the webinar earlier, and you'll be able to get through that process, and we'll help as much as we can so that you can get onto GP Connect. Thank you very much.